Hi, it's Stacey, and I'm here today at the Health and Spine Wellness Center. And I'm here because I have bursitis in my left arm. And bursitis, for people who don't know what that condition is, it's fluid in your arm. And over time, my arm has gotten really bad, and it's made it very hard for me to move my arm and to actually be able to do things, pick up heavy objects, exercise, you name it. I have a very hard time doing it because of the bursitis in my left arm. So I'm here today with nurse practitioner Patricia, and she's going to do a PRP injection to help my arm help self-heal itself. And she's going to talk today, and she's going to explain what PRP injections are and what she's going to be doing to help my arm heal itself.
Hi, it's Patricia here again. Today we're going to be drawing some blood from Stacey. Quick sample of blood draw, about of 1 vial, and we take her blood and then we spin it. When we do spin it, the blood separates into 2 components, plasma and blood cells, and we are going to use the plasma portion of her blood. That's why it's called plasma-rich protein, and I'm going to inject the plasma right into her shoulder area of concern. Why do we do that? We do that because we're going to use Stacey's healing benefits, her own body, to heal itself. So right now we're going to do the blood draw. The blood draw is a 5-minute procedure, and then we wait about 15 minutes while it's spinning into the centrifuge. All right, here we go. So let's have you, we're gonna roll up your sleeve. And this procedure is the same with any type of blood draw, whether you go to your primary doctor or the lab. It's a very simple, it does not hurt. All right, sit back, relax, yep. She is seated, make a fist, great. And for this type of procedure, I do recommend lots of fluids, especially the day before, during the day of the procedure, and of course the day after. Here we go. Little stick. 1, 2, 3. Great. Open your fist. And there's the blood draw. How you feeling?
I feel
Any
fine.
pain?
No pain whatsoever. I'm really excited about this because I've been suffering from bursitis for a long time, and it just feels like as time goes on, it just becomes harder and harder to use my arm. And my left arm is my dominant arm, right. So I'm always trying to use and do everything with my left arm. So it's really hard because when you have a busy life like most people do, and you want to get things done, it's hard when you have pain of any sort.
Of course. Put a finger there. Thank you.
After the nurse practitioner spun the blood, you notice that the blood is now on the bottom and the plasma has separated now, and it's on the top. She's going to use the plasma to inject into my arm for the bursitis to help my arm heal itself.
Hi, we're back again. It's been about 15 minutes. We spinned her blood, we had it sit, and I drew it up into the syringe, and this is what we get. This is pretty much regenerative. This is her body in the vial that I'm going to re-inject to help her body heal itself. I'm going to first spray a little bit of a topical aesthetic. Okay, ready? Some betadine.
Now what's the betadine?
Betadine is used to clean the skin.
Oh, okay.
Here at Health and Spine Wellness, we always use ultrasound guided procedure. It's best evidence and best practice, and it gives me straight into where I need to go. And I'm just looking for the bursa and where I'm going to give her injection.
Now the bursa is the inflammation.
The bursa is what's inflamed.
Okay.
and right in that area, okay? And here we go, ready? 1, 2, 3, good. How you feeling?
I feel fine.
And there's the injection, it's filling up that bursa. Feeling okay?
Yeah, I feel fine.
Okay, I'm gonna pull out and I'm going to inject the rest on the front part, okay? I'm now going to do a different approach, same concept going into that bursa, but we're going from the front end. I'm going to use a little bit of topical spray to numb the area. How's that, Stacey?
It feels nice and cool and
Good.
actually.
Okay, here we go. 1, 2, 3, and pinch. Good?
Mm-hmm.
Good. You okay?
Yes, I'm fine.
Good. Here we go. How you doing?
I'm doing good.
Okay. Nice deep breaths. Good. And hold on. She will maybe have some bruising and mild discomfort. That's very normal with PRP. Usually the day after, and about 2 to 3 days later, it's back to normal as far as any bruising or soreness. But soreness is part of the normal process.